This is Amanda Miller, and I'm recording this project on endometriosis for Greg Barnett's G150 Section 16 Structure and Function of the Human Body course. And the first step in understanding endometriosis is to discuss what it is. Endometriosis occurs when the lining of the uterus that is normally bled out during a woman's menstrual cycle grows on the outside of the uterus and on other organs in the woman's body. This is a picture showing kind of how the endometrial tissue can grow. So you have these darker purple areas are where the endometrial tissue is. It can occur on the ovaries, fallopian tubes, outside of the uterus, and they can even create these lesions where the ovaries are adhered to other organs. And here is a live photo of what endometriosis looks like in the body. They kind of show as these dark red or black areas. So what causes endometriosis? There is no exact cause that is known, but several theories do exist. One of them is that there are immune system disorders that prevent a person's body from being able to recognize when endometrial tissue is outside of the uterus. So it's not able to recognize that it's foreign and in the area where it should not be, so therefore it does not recognize it and destroy it. Otherwise, there are genetic factors. Women who have family members with endometriosis are also more likely to develop it. Therefore, a genetic link is suspected. The most likely cause, though, is the retrograde menstruation. This is where instead of menstrual blood flowing out of the vagina, it actually somehow flows backward up into the woman's body. This would create the endometrial cells from that menstrual blood would go backwards into the body and could attach itself to the pelvic walls, organs outside of the uterus, etc. And they could attach and then continue to develop, creating endometrial lesions. Is prevention possible? As of right now, there is absolutely no way to prevent endometriosis. Several factors can increase a woman's risk of developing it, though. So while there is no prevention, there is ways of telling if you're more susceptible to developing it. Some of them are never having given birth, other family members with the disease, a history of chronic pelvic infections, uterine abnormalities that would prevent blood flow from leaving the body normally, or other issues such as that. Some of the signs and symptoms of endometriosis are chronic pelvic, abdominal, and lower back pain, dysmenorrhea, which is excessive cramping before and during the menstrual cycle. Cramping is normal with the menstrual cycle, but women with endometriosis report that their cramping comes on sooner, it lasts longer, and it is stronger than what the average woman would expect with the menstrual cycle. Also, abnormally heavy bleeding during the menstrual cycle or bleeding between cycles. Yet again, heavy periods can be normal. However, women with endometriosis report excessively long cycles, needing to change their pads or tampons more frequently, having more leaks, etc. And pain with sexual intercourse, bowel movements, and or urination. fatigue, diarrhea, constipation, bloating, and nausea. In fact, endometriosis is often confused with irritable bowel syndrome because of these last symptoms. Many women who report these symptoms to the doctors just assume that it is irritable bowel syndrome or something else with the GI system. Okay, possible complications. There's a much higher rate of ovarian cancer in women who have endometriosis. While the rates are still low compared to other cancers, women with endometriosis do have a much higher chance of developing ovarian cancer. Also due to endometrial cells blocking the fallopian tubes or growing into the ovaries, ovarian cysts are common with women who have endometriosis. And perhaps the most devastating complication is that of infertility. About 33 to 50% of women with endometriosis have difficulty getting pregnant, which is why doctors suggest that women who have endometriosis make decisions regarding whether or not they want to have children as soon as possible so they can begin treatment for infertility if necessary. Endometriosis can be found in many systems throughout the body. Obvious is the reproductive system, which can be the lining of the pelvic cavity, the uterus, cervix, fallopian tubes, and ovaries. Can also adhere to the diaphragm and lungs of the woman's body. This is not as common, but it can occur. The urinary system, kidneys and bladder, and the digestive system, the bowel appendix, rectum, liver, and pancreas. There are several types of treatments for endometriosis. The least invasive and least extreme is at-home treatment options. This would include over-the-counter non-steroidal anti-inflammatory drugs, or NSAIDs. This would include ibuprofen, naproxen. These can be found in Advil, Motrin, and Aleve. Otherwise, doctors suggest use heating pads and warm baths to alleviate the cramping and pelvic pain if it is not too severe. If at-home treatment therapies do not work, there are intermediate treatments, such as hormone therapy prescription drugs. These can be in the form of pills, such as birth control pills, progesterone, estrogen supplements, things like that, skin patches, vaginal rings. They are meant to either suppress or supplement a woman's natural hormones, depending on what her hormone levels are. However, when a woman stops treatment with the hormone therapy, the symptoms do usually return at the conclusion of that therapy. If hormone therapy is either not an option or it does not work, surgical treatments are available. The least invasive is conservative surgery. This is where the doctor removes as much of the endometrial cells and growths as possible on the outside of the uterus, ovaries, fallopian tubes, wherever else it is. But they be sure to be as careful as possible to not leave it, to leave minimal scar tissue, to try and leave the reproductive system as undamaged as possible if the woman still wants to have children. The next step would be a hysterectomy. This is the removal of the uterus. It can be partial or total. Partial removes only the uterus, and a total would remove the uterus and the cervix. The most extreme surgical treatment is the salpingo-oophorectomy, and this is where the fallopian tubes and ovaries are removed. This is the most extreme method. It is typically the very last option that a doctor will choose, only after all other surgical all other treatments have been attempted. What are the long-term consequences of endometriosis? Obviously, infertility is the big one. However, endometriosis can also decrease the quality of life for a woman who has it. Even after treatment, studies show that 56% of women report painful sex, 59% still had painful periods, 60% still had chronic pelvic pain. 50% of women report a deep impact on their relationships, and 51% report a negative impact on their work. This shows that even with treatment, endometriosis can be insidious. It does not disappear. This is where, for women who are still suffering even after hormone therapies or conservative surgical treatments, a hysterectomy or salpingo-oophorectomy may be necessary. And that is it for my presentation. Thank you.